CPR and AED training that you had recently. So this is our man down. Remember, the very first thing you should have learned was to assess your scene for its safety. So remember, you want to see, is it safe for me to enter? There's no fire in that room. There's no traffic that might hit me. Anything that might be dangerous to you. If there's danger, don't go in. Okay, no matter what's going on with this person, if it's not safe for you, we're not going to risk ourselves because we're no good to him if we're in danger ourselves. Okay, so the next thing we're going to do is tap and shout. So, hey, are you okay? Are you okay? When you tap and shout, make sure you do it loud enough and you do it vigorously enough that you actually are sure that this person needs help. Again, I don't want to go pounding on this poor guy's chest if he doesn't really need it. I only want to do that if he's really in danger. So, I've tapped and shout, hey, are you okay? He doesn't respond to me, meaning he doesn't talk to me. He's not moving. I don't see any breathing, any signs of life. Okay, at that point, if I'm by myself, I'm going to yell for help. Help! If someone comes, great. I tell them to go call 911 and get me an AED. If no one comes, then I'm going to go leave to call 911 and get an AED. If no one comes and I saw him fall, so he clutched his chest and fell on the ground, then I'm going to go call right away. If I didn't see him fall, meaning I walked up into the room and I found him down after I did the hey, are you okay? I'm going to stay and I'm going to do CPR for 2 minutes before I leave. Okay, so you saw him clutch his chest and fall, you leave first. If you didn't see him clutch his chest and fall, meaning you found him lying on the ground, stay and do 2 minutes of CPR first, then call. That's only if you're by yourself. Best case scenario, you yell help or there's other people around, you're going to send one of them to go call 911 and get the AED. Okay, so we've established that. I've sent someone to go call 911, get me an AED. I'm going to check, make sure he's not breathing. He doesn't appear to be breathing. I'm looking for chest rise and fall to see if he's breathing. I don't see any chest rise and fall in this mannequin here. I'm going to say he's not breathing. From there, I'm going to start with my compressions. I'm going to put the heel of my palm on the lower half of his breastbone, so that big bone right in the middle of their chest. Lower half of it, okay? Interlocking my fingers, I'm going to press down. Do 30 compressions, press at least 2 inches in an adult. So if this guy weighs 400 pounds, it might be 4 inches. If they weigh only 120, about 2 inches, okay? You're going to do it at a rate of at least 100 beats per minute. That's pretty fast, 100 beats per minute. So if you know the song Staying Alive, you can do it to that. If not, you do about 30 compressions in 18 seconds. That would be your rate, okay? And you always have to allow for proper recoil, meaning the chest has to come back all the way to its natural position to let the heart refill with blood. So, my 30 compressions are going to look like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 6, 27, 28, 29, 30. Then I need to give them 2 breaths. Get your pocket mask. Remember, it has a teardrop shape. Sometimes they'll be so nice and they'll even say nose at the top. That goes over the nose, around the mouth. Make some gentle downward pressure. You don't want to squeeze, you don't want to mash, just gentle downward pressure. And then you need to tilt to open the airway and deliver 2 breaths. I just need to see chest rise and fall. You don't need to blow them up too much. If you blow them up too much, it causes air to go to their stomach and then that person is going to vomit. We don't want that. That would be not so good for him or you. So 2 breaths. There's 1 breath. Notice you see chest rise and fall. We're looking to see the chest rise and then fall. Then I'm going to go directly back into doing 30 more compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 8, 29, 30. Go right back into giving 2 breaths. And you're going to continue that cycle of 30 to 2, 30 to 2. You can do 5 cycles in 2 minutes, okay? But you're going to continue to do that until someone returns with the AED. Okay, so it might be 2 minutes, it might be 5 minutes, it might be 3. But the important part is to continue doing that 30 to 2 cycles until the AED arrives. When the AED arrives, it is best to have someone continue doing the compressions while someone else operates the AED. Now, obviously, if you're by yourself, you're going to have to operate the AED, and no one's going to be able to continue with the compressions. But if you can, the best thing would be to continue compressions while someone else operates the AED. For this particular type of AED, the way we turn it on is open the lid. You're going to take out this package. You're going to tear it open.
Tear open package and remove pads. Tear open package and remove pads. Tear open package and remove pads. Peel 1 pad from plastic liner.
Peel 1 pad
from plastic liner.
Place in the upper right.
Peel 1 pad from plastic liner. Place 1 pad on bare upper chest. Place 1 pad on bare upper chest.
I'm going to peel the second pad.
Place 1 pad on bare upper chest. Peel 2nd pad and place on bare lower chest as shown.
Bare lower chest, just like it said.
Peel 2nd pad and place on bare lower chest as shown. Do not touch patient. Analyzing
Okay, so I'm going to clear the patient. No one touch the patient.
Do not touch patient. Analyzing rhythm. Shock advised.
Notice right
Charging.
now, it's
Stand
charging.
clear. Push flashing button to deliver shock.
I'm going to say, everyone
Stand
clear.
Push flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Give 30 compressions. Then give 2 breaths.
So then I'm going to go ahead and I'm going to start again with my compressions. I'm going to do 30 and 2. Now I close the lid, that turns this off. In real life, you would leave this keep going. Every 2 minutes, it's going to reanalyze. The only reason I turn it off is that it's a little hard to hear me over the machine. But you would leave that on. It might tell you to shock again in 2 minutes. It might not tell you to shock in 2 minutes. Whatever it says to do, you're going to follow the directions. In between this analyzing and telling you if you're shocking or not, you should be doing compressions. Remember, the only reasons you stop are this person wakes up, so they start looking like they're breathing on their own, they're moving, they're talking, okay? Or someone with medical training comes, so an EMT, a paramedic, a firefighter, maybe even a policeman. Or, last thing, you're physically just too tired and you can't go on anymore. And if that happens, it's okay to stop.